Good day. I'm Julie Thompson, the Executive Director of PAC TV and facilitator for this COVID-19 update for the town of Pembroke. Today I'm joined by Lisa Cullity, the health agent, Ed Thorne, our town administrator, Aaron Obie, our superintendent of schools, and right now, Josh Cutler, our state representative. In the future, we'll have Richard McDonald and Ken McCormick of the Pembroke Fire and Police Department. So right now we want to just start with some information. The purpose of today's forum is to give an update of information and resources to the residents, organizations, and businesses that live and work in Pembroke. At PAC TV, we contemplate that we will be hosting updates from all of our towns we serve on a regular basis. And to that end, we've set up a special email for people to send in their questions for our town officials that we'll be answering on the next forum. Please email pembrokeinfo@pactv.org with any questions you have. We're going to start today with Josh Cutler, who can give us a statewide interpretation of where we are right now.
Lots going on. Thank you, Julie. Thank you, PAC TV for hosting this. Thanks to my good colleagues here in Pembroke for all the good work you're doing. Lots going on, obviously lots of developments. Literally, I just drove back from the State House to come here this afternoon. As many folks are probably already familiar, there was a number of executive orders that were issued yesterday by Governor Baker, one of which was closing all schools for 3 weeks. Obviously here in Pembroke, we'd already taken that step. Great work for our Pembroke folks, but that will be extended for an additional week to 3 weeks. The gatherings limit was previously 250. That has been reduced to 25. Obviously a significant change. Restaurants and bars and eating establishments are not to allow dining in options, so it would be only takeout. We've increased our options for telehealth so that folks that have medical visits, it's all supposed to be able to be insured as a telehealth option alternative.
The first option
yes.
is telehealth. Okay.
Nursing home visits have been banned, essentially. Unemployment, I know I get a lot of questions about unemployment-related issues, unfortunately, with all the economic changes that will come with these closures. Unemployment regulations have been changed, and we can talk about that more in a moment in more detail.
Okay.
The governor today at 4 o'clock will be having another news conference along with House and Senate leadership to talk about some things. I was there at the State House this morning, and the governor did file several pieces of legislation, one having to do with unemployment insurance, changing some of the rules to relax. For instance, there used to be a 1-week delay period, so eliminating that so people can get their benefits quicker, allowing for businesses that might be contemplating just a 4-week or an 8-week shutdown, where normally you might not qualify for unemployment if you're to lay off your employees, but to allow them to do that. Other things that will make it easier for folks, for business owners and also for employees to kind of get through this tough time. So that some of those things can be accomplished by executive order, meaning the governor can just write an order and sign it. Others do need the legislature to take action. I can tell you that the State House remains open, a very limited basis, but our House and Senate leaders are constantly in dialogue. There were a handful of legislators there today, obviously, practicing safe distances and all the proper precautions. Our House clerk actually had gloves on when he was holding the bills. And the Senate actually, our state Senate is actually meeting virtually, totally.
Which a lot of towns and committees and boards will probably be doing.
And again, one of the things that here we have, with our local leaders, cities and towns having to deal with things like town elections, town meetings, quorums to have a school committee meeting, quorums to have a board of selectmen meeting. The governor has already issued an executive order to relax some of those things, to allow remote meetings to occur. There's some other issues that involve town meetings and also town elections in terms of whether or not they should be put off, whether the conditions should be changed, whether the polling locations should be adjusted. All those things are being discussed right now. And I know I've heard from folks in Pembroke, from folks at this table, but also our town moderator. And those are all things we're actively talking about to find ways to give more tools to our cities and towns to deal with this, because it's obviously unprecedented.
Question, when does what the governor says for the state trump what local people do? And do we have to follow everything that is said by the state?
So the executive orders issued by the governor set basically a floor. If the town of Pembroke wanted a more stringent regulation, they could do so. They cannot do one that is less stringent.
Okay, so this is the minimum base.
Correct.
Okay, gotcha.
So for instance, if Pembroke would to extend a school closure longer, that's something
that's
they
fine,
could
but they
do.
have to at least do it for 3 weeks.
But they have to at least do it for 3 weeks.
Okay.
Same thing for the gathering limit, any of the rules that have gone into effect.
Okay.
Those are minimums.
Okay. Did anyone have any other specific questions for Josh on that?
No, I think what Josh mentioned briefly was about town meeting and the budgetary process.
Yep.
Right.
That kind of relaxed, and it may actually allow towns, which are not allowed right now, to go into the new fiscal year without a budget.
Right. So
Right.
obviously, cities and towns have July 1st deadline coming up.
Right.
They don't currently have the ability to do what we call 1/12 budgets, which is meeting a month at a time.
Oh, okay.
That the state does have that ability. So giving that ability to towns is one thing that I know our town managers are looking at, are looking for, and that we're looking at. But there's other things like if you delay your town meeting, for instance, the town of Duxbury just had town
Right.
meeting over the weekend, and they actually gavelled in, delayed it,
gavelled
and
out.
then gavelled
Yep.
out.
Yep.
That's one way to handle it. We don't know for sure that we'll be able to have that town meeting when it's scheduled in the
Right.
future. What if it has to be gavelled out again? And what if the fiscal year comes and
Right.
we have to pay our employees, we have to have a budget in place.
Right.
So giving the towns a little more flexibility with those things is definitely on the table, and I think it's something that you're going to see pretty soon.
Okay. Erin Obi, Superintendent of Schools.
So we just sent out an update to families this afternoon. The email contains kind of some of the same information that Josh was just talking about. So originally we had closed schools through next Friday, but now that's extended through Monday, April 6th,
Yep.
with the potential to open on Tuesday, April 7th. We have been updating our website with all of the communications that we send out. There's also a feature on our website called Titan Talk, which if you have a question, you can go in and ask at any time, and it alerts us automatically that there's been a question. But there have been a few questions already circulated, so I'm happy to answer some of those. The first being around distance learning. So the expectation is that students continue some sort of learning while they're out on this extended break, but it's not learning that's assessed or graded by teachers. So on our website today, we put up a tab with some links. It is grade level specific, so there's definitely enrichment opportunities there for students K through 12, put together by our teachers, our content supervisors, and our administrators to keep kids in the learning process while we're on a break. That raises the question about special education. So we're currently putting together some resources for special education families as well. Some of the questions that we've gotten around special ed are if you have your reeval, your IEP reeval coming up. What does that mean for my meeting? So currently all of Pembroke Public Schools buildings are closed to the public, meaning the doors are locked, but there is essential staff inside. So if you have questions, we're urging you to call the offices or email the principals, and they'll get back to you in a timely way. But as far as coming in, picking up books, I forgot my trumpet, none of that type of activity is happening over the next 3 weeks. Food services has been another question that we've gotten. So starting tomorrow, March 17th at North Pembroke Elementary School and Hobbamock Elementary School, we'll have grab-and-go meal service for families. So it is a lunch and a breakfast option, so you can take both, so a lunch for that day and a breakfast for the next morning.
Yep.
The hours are 11 to 1, and we are just kind of figuring out the logistics right now, but committed to doing it for this whole week and then looking into next week on whether we expand the hours or the sites. It is truly grab and go, so the tables will be right at the exterior of the cafeterias. You don't need to come into the building.
Okay,
You're just
so the
signing.
parent would just come in,
They're
sign
just
someone's
signing
name.
what school their child goes
Yep,
to and taking
yep.
the meals.
And is this? Do you have to have signed up for this all along, or is this for any resident?
No, because Pembroke is below the 50% free and reduced lunch reimbursement rate, we don't receive federal funding for this at this time. I know there's been some conversation about potentially going to foundations to back fund for the school districts that don't qualify, but for us, it's just about getting food to families that need
Okay,
it. So
so
at this
anyone
point,
can do this?
Yes, any family member.
And you're going to update your website daily if necessary.
Daily, if not
right?
hourly.
Yeah.
As we come across new links for students and families, we'll put those up as well. Our social workers have been doing a lot of work around resources for talking to your kids about what's going on, right? So this presents a little differently in elementary students than it does in secondary students around fears. Again, it's pretty novel on the first day that there's a break for 3
Oh,
weeks.
it's fun. It's a
yeah.
vacation. Yeah,
And I
for
do want to
now.
caution people, I'm sure that Josh has said it before, this is not a snow day. You should not be having play dates with your friends. The local mom shouldn't be getting together and going to an indoor trampoline park. It's really about kind of hunkering down at home, spending time with your family. We were kind of joking before, going for a walk at Tubbs Meadow or doing some sort of outdoor activity, but it's not about having play dates. So a lot of the resources talk about those fears in kids. Will I ever see my friends again? How come Nana and Grandpa aren't visiting? Those type of
And those
informational
are legitimate.
pieces. Right.
Yeah, I mean, kids are going to ask that.
Right. And then there's some logistical pieces. So with the testing, the MCAS window for grade 10 ELA is supposed to open next Tuesday. Obviously, we won't be in school, so there was conversation with the commissioner about extending that window. So at this point, the plan is to lengthen the window of time. But if the closure goes past April 6th or 7th, we'd be talking about potentially waiving the MCAS, and Josh is probably better suited to discuss that, but there's definitely federal and state legislation that has to happen for that to work.
Okay.
Additionally, people have been asking about April vacation. So
Yeah.
April vacation is still on as scheduled. It is April 20th to the 24th. At this point, we're still moving forward, but if that needs to change, we will adjust as we go. Other things that we just don't know the answers to. So will graduation still be,
Right.
Saturday the 6th? Will the
we don't
sixth
know.
graders go to Camp Warrendale? We don't know that at this time.
Okay.
But as soon as we do, we will let families
Right.
know and plan accordingly.
And you're saying, no play dates. Lisa, you made a really good point before we went on air about how important it is to really take this serious about social distancing, et cetera. And you made a comment about how we're actually lucky to have learned from other countries.
Right. So when I was asked the question, is there any kind of a silver lining to it? There is. Imagine being in the position that China or Italy was without any of this information and this disease coming at you, and how do you respond? We are able to learn from the misfortunes of others as well as their achievements, and that's really helpful. And the social distancing is one of the lessons that was learned, social norms needing to change. Obviously, there's cultural differences there that are also going to have an impact, but I think we have the lucky opportunity of being a little bit more ahead than, unfortunately, in their position being a little bit behind with the isolation that we're already asking people to take for themselves.
Yeah, and the data and how
Yes.
important the data is. Now,
It really is.
Speaking of data, let's talk about testing.
Sure.
Yeah.
Go ahead.
That's
Jo-
probably
Josh,
the number.
yes, the
number
number
one.
one.
or number
They're up
two
to
question.
quadrupling, right?
Yeah.
That's what they said,
question
the throughput.
that I get.
Yep.
Yeah, so we know, and obviously by the time this airs, we'll probably have updated testing data. But as of Sunday, there had been 164 positive cases in Massachusetts. And people do ask me about the presumed or confirmed case
Right.
distinction, which
Yep.
I think is important. It's sort of a meaningless distinction. If a case that's presumed or presumptive just means it was a test at the DPH state lab here in Massachusetts. A confirmed case means it was tested at the CDC.
So it was already positive here.
It was already positive.
Okay.
So really, they're
So it's a
all
secondary
positive
positive.
cases.
Yeah, okay.
Just because of the way the process
Yep.
is, that it has to use that terminology.
Yep.
So one of the big questions we get is how many tests were being given,
Mm-hmm.
and that information, as of yesterday, was 799 tests. Now this is tests done at the state lab.
Mm-hmm.
It's important to note that private commercial labs, LabQuest,
Quest,
Quest,
yep.
ProLabs,
Yep.
and there's a third one, now have FDA approval to begin tests, and they have additional testing. Now, some of those tests can take longer.
Okay.
A test through the state lab should take 24 to 48 hours. Some of these private testings can take longer because some of them have to submit their specimens out of state.
Yep.
We expect, and this hasn't happened yet, we expect that our academic medical hospitals will soon be given authority to test as well.
Okay.
That would dramatically increase our ability to conduct tests, which
And
has
have
been
more data.
significantly limited.
Yeah.
When we started this, literally just a week ago, there was a capacity of about 50 tests a day
Yeah.
at the DPH lab. It's now about 400 tests a day, which is still not adequate to meet the demand and the need. The governor has said we really want to be hitting at least 1,000 tests a day to be able to kind of hit the points that we need to. We're getting closer. We're not quite there yet, but I think every day we're making that capacity is going up significantly.
Right.
The other thing I would just say, and Lisa can attest to this, we've had at least 2 positive cases in Plymouth County
Yep.
that we know about, a positive test in Hingham, a positive test in Hanover. I suspect, that's just the
Tip of the iceberg.
the tip of
Yeah,
the
there's
iceberg.
certainly more
And
positive
today
tests.
we'll probably
That's
hear
right.
of more cases in Plymouth County as
Yep.
well.
Okay. Testing for Pembroke for seniors. I know a lot of seniors are very concerned about
Yep.
being tested.
So the criteria hasn't, it's relaxed a little bit, but the criteria in order to be tested is still pretty specific. It has to be confirmed contact, overseas travel, and everything else. And obviously seniors are the most concerned. The data is telling us that seniors are by far the most vulnerable population to this. So the hope is, what the towns are hoping and what DPH is trying to lead the way, if you would, with, is getting those testing numbers up that Josh told us about, that is really what needs to happen the most, because the more throughput we have, the more people we can test.
Right.
I know a lot of the senior centers any facility working with older adults is closed off to the public, and wisely so, as is the one facility within Pembroke. And I know other facilities within Pembroke that have sensitive populations for different reasons are also limiting, if not eliminating, visitors to
Yes.
them for obvious
Nursing
reasons
homes
for
have
safety.
eliminated all visitors.
Nursing,
Yeah.
anyone dealing with
Yeah.
senior population,
Yep, which makes sense.
You know,
Absolutely.
because there are others. It's not just nursing homes. There's memory care facilities and
Yes.
all kinds of other things. So they've eliminated that interaction, which is a very wise move for their population safety.
Yep. Ed, biggest thing facing the town managers.
Well, we've been in contact. We have a South Shore Managers Association that's grown from the immediate South Shore all the way over to Westport and Mattapoisett and all. I think we have 28 communities in that organization. And we've been in contact almost hourly. I mean, dozens of emails every hour about what we're going to do, and all this started last week. And then we had a conference call this morning at 11 o'clock and pretty much finalized what everybody's doing on the South Shore and South Coast. Basically, all towns have schools shut down. Town halls are going to be closed.
Yep.
About 95% will be effective tomorrow morning. Some close this afternoon. Council on Aging's, libraries, recreation departments, and now it's even expanded to playgrounds and ball fields and whatever.
Right.
So the web has really widened, and like I said, 95% of all the towns right now are pretty much doing the exact same thing.
Right. So you're sharing the same information.
Right.
Now, what about meetings, boards, committees, weekly meetings that people, I'm going to watch the selectmen's, I'm going to watch the planning board.
Well, we're going to issue a couple of announcements this afternoon. Number one, Vice Chairman Boyle signed a declaration of emergency.
Okay.
Declare an emergency for the town of Pembroke, as a lot of towns are doing. So we had that out of the way. And then we're issuing a release this afternoon, which will explain to the public that Town Hall will be closed, but Council on Aging will provide all of the external services, such as Meals on Wheels and trips to doctors that are needed, and all the extraneous, the items that they provide. Not having the COA closed. Same with the library. The library now has made the decision that they'll be closed to the public, and of course we made the decision at around 11:30, 12 o'clock that we will be open until 4:30 today, and then not open tonight, and then all meetings that are not required by law, if they already have a public hearing they had to set aside, will be canceled. The planning board had a series of zoning bylaw articles, but they can put that off for a while. The Board of Selectmen will have a meeting Tuesday night. It'll be closed to the public, and we've already talked to the individual that has a public hearing and scheduled for them, saying that they don't have to be there.
Okay.
And then we'll just be playing it,
Play it by ear.
week by
Yep.
week by week with all of these meetings. And as Josh mentioned earlier, we have a little bit of leeway for our town meeting. And one of the things that's interesting that was being proposed, and I don't know if it's set in stone yet, Josh, is to reduce the quorum
For
for a town meeting.
For town meeting.
Yeah, I think that was part of his order, the governor's order. Originally
That's a good
said
question. I don't recall that specific issue, but
I
certainly
remember
that's
seeing
something
that.
I think
No,
we
Yeah, I
could-
know it's-
it was in the
that. It was
order.
definitely
Oh,
was in the
okay,
order.
because it did come
He
up in our
actually
conversation
suspended
with the
need for
managers
quorum,
today.
I thought you were going
was,
to talk
yeah.
about the town election, but that's another,
Yeah.
whole nother issue to deal with.
See, some towns have zero quorum.
I know,
Right.
Duxbury has no quorum, yeah.
Right,
Yeah.
but ours is
the-
150.
Yeah.
There is a provision in current law that before this happened where you could postpone for 30 days. A town moderator could
Yes.
along with the board
Yeah,
of
and then they
selectmen,
have to do
without
another
the
one.
need to meet the quorum.
Yep.
That would help in an interim basis. But
Right.
obviously, 30 days may not be enough
Yeah.
in this situation, which is what we're
Now, what
looking at.
about the special election on March 31st for the Senate seat?
We've had discussions with the town clerk and the board of selectmen. I believe there's going to be further ones today about what options should be taken, including
There was an email that went out that you could do,
Well, obviously, no matter what, we want to encourage people to absentee vote.
exactly.
and
And then you
we're-
could actually download it online.
You can
and
download
mail it
online.
in, so you never have to go in.
Never, yes.
Yeah, which is great.
And the nominal restrictions on absentee voting about not being physically present
Yeah.
are being waived.
Sure.
So everyone is eligible who's otherwise eligible to vote.
Yep.
Everyone is eligible to absentee vote. And I
Okay.
think we would all strongly urge everyone
doing that,
to
yes.
take advantage of that. You can download the form. It's
Yes.
on my Facebook page. It's on the town's page. It's
Yes.
very readily available.
Yep.
You download that. You fill it out. Mail it back. They will send you a ballot.
Yep.
And
There you
mail
go.
it back with an envelope. It's as easy as could be.
Yep.
It's like early voting, but
Yep.
not. So we would strongly urge folks to do that. We do have a special Senate election coming up soon, and then the town's annual election, and we're talking a lot about how that should be handled.
And that we'll probably have more and more information
have more
each
info on
day
that
on that
soon,
one
yep.
too. The two things that seem to be really troublesome to people is, number one, the amount of people that are going to either ERs or health facilities that should not be just walking in as their first line of defense.
No.
And secondly, the ridiculousness of the hoarding that's going on from the supermarkets, which just is so unnecessary.
It
That's
is
the thing.
unnecessary. It is crazy.
It's born out of fear. And
It
it's
is.
just,
It
you want to
absolutely
speak
is.
to that?
So we get a lot of calls on that, and there seems to be, for whatever reason, the belief that the governor intended to order everyone to stay in their homes and not leave. That's one of the instances that led to some of the hoarding with some of the people that I've spoken to. The other thing, unfortunately, is a very sad reason. There are those that would go up and buy mass quantities of items with the hope of turning a substantial profit by turning around and reselling those items at a significant markup. I can't echo the governor enough in his statements of, please don't do this. You're not a profiteer in this, and if you are, you need to re-examine your moral compass. Secondly, when you do this, you're not hurting the average individual like myself, or probably most of the people at this table. You are hurting the most vulnerable populations. You are devastating the most economically challenged that can only afford to grocery shop by the week because that's what their income level allows. And you're hurting the seniors that also only get out often once a week. So you're not going to make money off of the average person that can afford to pay you your inflated rate. You are actually hurting the already most crippled demographic we have. So please reconsider that. The thing I would also throw out is perhaps you did overbuy. Maybe you didn't overbuy out of greed or anything else,
Sure.
but out of paranoia.
Yep,
And
understood.
if you have surplus, why don't you reach out to your senior neighbors and say, I overpurchased, because I've done it too. You go to BJ's, you get a little excited, you get a nice wheelie cart, and the next thing you know, you're buying the mega pack of
Yeah.
25, 4 packs of toilet paper.
Yeah.
Think about taking some of those packages and seeing if some of your senior neighbors perhaps didn't get much as they needed or any at all, and share some Campbell's soup and some toilet paper with them. That's a wonderful thing to do.
Yep.
But going back to your previous statement about walking in, if you are symptomatic, please reach out to your primary care and get guidance about what you should do. Depending on your level of symptoms will determine what you should do, and your primary care is the best equipped to help you with this. Walking into an ER does nothing other than expose everyone else there to whatever you have, and that ER may or may not even be able to help you. I know a lot of people feel like by going to a hospital or a walk-in that will somehow, their physical presence will lead to faster testing. Nothing could be further from the truth.
Yep.
The testing criteria is the testing criteria.
Right.
I have not heard one person circumvent
Yeah.
the means to the testing criteria, and your primary care is your best advocate
Yep.
if you meet the criteria for testing. So please start there.
I couldn't agree more with Lisa, but I just wanted to add on that because of the telehealth order, you can now do all those things
Can
remotely.
you
Even
just
better.
explain telehealth
So
for
the
anyone who
governor
doesn't
has, through his
understand it?
executive order, has said that any medical appointments, visits that are necessary
Yep.
will be covered through telephone or telehealth.
So you don't have to go in
methods. So
person.
you don't have to go in person. So if you have a copay or whatever it is, your insurance will cover it to the same extent that they would if you had to go in person via telephone or
Yep. Oh,
remote or
wonderful.
email.
Okay.
So if you are symptomatic,
Yep.
I believe you are, call, email
Right.
before you go in and do that.
And even
so
for
the
things
telehealth,
like if you need your prescriptions refilled, I mean, people
right,
like
and
they're-
people still
they're
have
so
things they have to
afraid.
live their
Yeah,
lives,
but they can
and
do that
they
more
can do all that. And it's all
online
going to
or
be
through the
covered.
telephone.
It's all
Right.
going to be covered. There's not going to be any additional costs.
Right.
It's all going to be covered through this
And,
telehealth
and
order.
did I hear this correctly, that not only the tests but any treatment for this coronavirus is covered?
So there's different. So the GIC, which is the Group Insurance Commission, and a number of private carriers have said that. Yes, and Mass Health has already said that. So that should apply to nearly 100% of
Okay.
Massachusetts residents.
Okay.
The only other piece of information I would add is just because it comes up with the hoarding, is the governor has authorized pharmacists to synthesize and sell hand sanitizer.
Okay.
Because there are shortages, and so that will give a little more flexibility, so that once You should check with your local pharmacy, but
Okay.
they are authorized now to essentially manufacture hand sanitizer,
Right.
which is apparently not that complicated if you
Okay.
have the right materials.
All right. Anything else for this group before we bring in police and fire?
I would just say, number one, just to give out the website or in terms of resources, my website is joshcutler.com. I've been posting a lot of information
Yep.
on my Facebook page.
Yep.
I would encourage folks to look at that. We'll be coming up because I know a lot of folks are anxious about the economic issues surrounding this.
Yes.
We'll be posting some information, additional information about unemployment insurance and the proper steps
Yep.
and what's coming later today on that.
Okay.
And the last piece of news I would say is just there's, the governor's scheduled to meet this again Monday afternoon with House and Senate leadership. There could be some news coming out of that.
And
we
you'll
heard-
update us.
I will
Yep.
update everyone,
Yep.
and then we heard just as we were coming in here that the MBTA and the commuter rail will be operating on a reduced schedule
Yeah, I
as,
saw
of,
that
as
too.
of tomorrow.
Okay, thank you. So we're going to say goodbye to Erin Obie, Superintendent, and Josh Cutler. Thank you so much.
We'll happy to come back another time.
Oh, we will. Oh, we will. We'll be back in just a minute. Welcome back to the COVID-19 update for the town of Pembroke. We are continue to have Lisa Cullity, the health agent, and Ed Thorne, the town manager, and we are joined by Ken McCormick, who's the deputy fire chief, and Rich McDonald, Lieutenant Rich McDonald from the police department. Thank you for joining us too.
Welcome.
We've heard from our other guests. Why don't we start with you, Rick? Police, what do you have to tell our citizens regarding this whole event?
Well, without being redundant, I'm sure you talked about it previous. Ultimately, the fear factor is a huge thing right now, as you see with the supermarkets and the hoarding, whether it's toilet paper or sanitizers that are out there. Along with you talking about people waiting for buying guns. I haven't seen that. That's the first, but that's part of the fear factor. And it's just not rational behavior. Slow it down a little bit. As far as us with protocols, we screen medical calls. So if there's a person with flu-like symptoms, we will not send a police officer there.
Right.
There's no need to. In that case, obviously the fire requests us to come in for some reason. We will go for that, but that's the only reason we'll go for those type of calls.
So the 911 calls still go into the police?
We still
You
we
screen
do
them?
the EMD, yep,
Okay.
and then transfer to the fire.
Okay.
And we also, practice the social distancing in the station because it's a, small area. Keep them on the road preferably, and kind of minimize the distance between the officers.
Oh, absolutely.
Right.
And prisoners you bring in, cells? I mean, that must be a
Yeah,
that's a whole nother.
That's a concern. So we're trying to minimize that. So if we can summons people, we will do that. So we're minimizing contact with people is something we're trying to do. There are times we have no choices. We're mandated to arrest, and then we just have to use good common sense.
Yep.
We do issue protective gear to our officers to protect themselves. If they go into something knowing somebody has flu-like symptoms, they will don that stuff up if they have the time to do it.
Right. And that's the challenge that police always have. Do you have the
Right.
time? Same with fire. Do you have the time? If it's life or death, you have to take the.
Yeah.
Do you have other items you want to handle?
I'll go
yet?
as we speak.
Okay.
Yeah.
Okay. And Ken, what is changed or what will change for the fire department?
So other than trying to protect our members first has changed, where we're now donning PPE, we're now listening to flu-like, going through the CDC protocols for COVID-19.
And how is that different from?
Normally we
6
didn't.
months ago.
Normally we didn't. The flu runs its course through the firehouse. So
Yep.
if it was a flu call, you went. A couple guys went in, maybe 3 guys went in. We've now limited the people that go in. We assess. If we need more personnel, we bring them in.
Okay.
If we need to dress in personal protective gear, we'll do that. So that's kind of changed a little bit. And the second thing, like we discussed earlier, is we don't want to use PPE for every single call because we will run out
And that's
quickly.
personal
Yeah, the
protection.
personal protective equipment.
Okay,
Which is the
PPE,
mask, the
yep.
gown, goggles, face shield.
And you can only use those once.
You could, yeah, ours
Right?
are throwaway. It's a single-use type of dress. We don't want to use it on every call.
No.
So that's why EMD is doing what they're doing. They're going through the protocol. They'll let us know, and we're going to use it for any breathing and/or shortness of breath, respiratory type
Yep.
issues.
Right.
Other than that, if you're calling because you have back pain,
Yeah.
you haven't been out of the country,
Yeah.
you don't know anybody that's been out of the country, you're not fighting a cold, you
Yep.
don't have a fever,
Yep.
it's kind of going to be a routine medical.
Right. So we're really asking people to be a little bit more cognizant of when they call.
They are.
Because some people call,
Right.
I fell down and I think I hurt my back.
Right.
And
That's
Yeah.
what it is. It's a
It's
back
what it is.
injury.
Right,
You know,
right.
if you have been diagnosed previously by a medical and
Yeah.
they told you to stay home for 13 days or 12 days,
Stay home.
and you don't like that answer and you call us, just try to heed what they told you.
Right.
If things change, by all means, call us.
Right.
We'll be there in about 4 minutes.
Right.
But just to call every single time because you didn't like a diagnosis and then go back and get the same diagnosis,
Yeah.
you got to kind of heed what your primary care is telling you.
Yep.
It's really important right now.
Okay. Any concern with all the kids now are going to be out of school for at least 2 weeks? They're not supposed to be hanging out together. They're supposed to be social distancing.
It's a challenge even for like the household with just one child now. You just
Right.
one child all day alone.
Right.
I have a bunch of kids, so that's not an issue. It's like they're built-in play care, but it's even tough for my situation because they want to see their friends. They really don't understand, and they're afraid. They watch the news, they watch the adult reactions, and sometimes they become anxious because of it. So and it's hard. So we try to get their minds off it. Try to keep them away from the TV to watch the news because it's out there all the time.
Yeah.
And at the same time, it's a balancing act for the adults. They're having a hard time not being social and
Right. Right. But you're right about the kids do take your cues from your adults.
all day.
Yeah, the more nervous the adults are, the more nervous the children are, and that's why it's so important that we just stay as positive as we can and arm ourselves with information. If you saw a whole bunch of kids together, grouped together at a skate park or something, and they're all hanging out, are you supposed to go and just remind them about keeping distance, or are you at this point not doing that?
Yeah, to your point, I think the word remind is probably the best way to do it. 'Cause
Sure.
Police inherently with the uniform and the authority intimidate people, and
Yeah.
we don't want to go that route.
No.
So yeah, it's just, hey guys, break it up. It's
Yeah,
not healthy.
remember,
Just
right?
have a
Remember,
conversation.
right?
Right.
For
exactly.
each other's sake, we
All
want to
day.
keep each other safe,
Yeah.
safe and healthy.
But going back to the point that was raised before the lieutenant was in the room, this is why, in speaking with Sue, our recreation director, this is why we're going to be closing the Pembroke Center recreational courts. This is why the libraries are going to be, the playgrounds are going to be closed
Yeah.
and locked to avoid those places of congregation. Obviously, I'll be reaching out to Aaron Obey. I would be very surprised if the school wasn't already safeguarding their recreational areas by locking those off too, so that people aren't congregating at them. And we're doing that, of course, out of abundance of caution for people's safety, but also to support our law enforcement officers so they run into as few of those situations as possible.
Right.
At the end of the day, we all know kids will be kids.
Yep.
I'm hoping the kids are getting good guidance at home on why congregating in large groups is not a safe activity right now.
right.
But again, these things are going to occur, and we're going to address them. And the tough part is a lot of the calls I get are always like, well, why wasn't this already done, or why didn't someone already X, Y, and Z? And I think as demonstrated by our leadership at the State House, which is now really obviously stepped up quite a bit, the information is changing daily, and we have to respond to the data that's presented to us. And confidently, there might be further adjustments within the government of Pembroke responding to the situations that we see to make things as safe as we can make them without obviously, completely stripping people of their civil liberties.
Right. Do you see any problems at all with the 25 people or less mandate of people getting together? Like clearly in a supermarket, you're going to have more than 25 people in a
Employees
supermarket.
itself, just
Yeah,
the workers,
so that kind of goes out the window. But
Proximity, Lisa
it's-
mentioned it.
it's more proximity that we're worried about.
Not
And
as
hygiene.
much.
Yes.
Hygiene is an enormous factor, and everyone, yes, we're concerned about people gathering in large numbers, and yes, we're concerned about people's interactions, but hygiene has such a huge component that as these regulations have come out, I feel like people are forgetting the hygiene portion. Facebook last week was wash your hands, wash your hands, wash your hands, and now all I see is closings and bannings in schools and everything else. Let's go back, people, take one step back. We're all going to have to go out inside the world at some point in time. If you don't have to, wonderful, don't. But when you do, you're going to sooner or later need to do something or buy food. Remember to wash your hands before you go. Remember to bring sanitizer and wipes if you have them. Get what you need. Remember to sanitize and wipe on your way out before you go back into your home. Personal hygiene, personal care is going to go a long way to keeping you and your family safe. So let's not ever forget that aspect.
Right. And if you do have to call the police or fire into your home, let them know,
Yes.
I have someone that's ill. You might not have COVID-19, but just let them know there's someone that's ill in
We
their
do
home.
ask those questions. So if we get something medical and we ask, and it's related to flu-like symptoms, anybody in the house that's symptomatic or they traveled abroad somewhere along with, because we have to give the fire, even though they're getting the same information, pre-arrival instructions sometimes it
Sure.
changes. So
Sure.
we have a queues of lists of things to ask, and each time it's just the same response as far as same questions are asked every time that type of call comes in. Excuse
Okay.
me.
Yep.
We're going to try to have you help yourself a little bit too, to Lisa's point.
Yes.
If you have the flu and you call and you can walk out,
Yeah.
and we're more than happy to give you a mask. You can put that on.
Sure.
It is the flu.
Yep.
You know,
Yeah.
there are some people in various degrees of the flu, but
Right.
most of them can walk.
Yep.
We'll have you walk out to the ambulance. That way, no one has to go into your house.
Yeah.
We've protected ourselves. You're protected yourselves.
Yep.
We'll load you up, take you to the hospital, take you to where we have to take you,
Yep.
and get you fixed up.
And we're actually fortunate that it's this time of year that this is
Yeah,
happening to
true.
us,
We're very
not the
lucky.
dead of winter
Yep.
or during a blizzard. That would
But
be
it's got to
crazy.
run its course too. So.
Yeah, it is.
And we don't know. We
No,
don't
we
know
don't
if
know.
this is
No one
going to
knows.
die
It's-
out and then come back. We just
ever
don't
evolving,
know.
so-
Right.
There's a
We just
lot
don't
of
know.
unknowns. In the countries that have seen it, for example, China is now seeming to be on the decline, and I'll knock on some wood right now that we continue to see those results. Obviously, what we're seeing in Italy is getting what I hope is close to or at their peak, so that they
Yeah.
can begin to recover from this. But back to your point of 25 persons, obviously. There's no safe number. Us sitting at this table is technically, by every definition of spreading a disease, unsafe.
Right.
So we all have to come up with some sort of measure of how safe can we make ourselves and how safe is reasonable. I mean, obviously the idea that I'm not going to get together with these gentlemen is impossible. I can't perform the function
Sure.
I'm required to perform, for the town, nor could they ever perform their jobs if we don't. So there's a certain amount of calculated risk that has to be taken. And I think the whole idea here is to minimize your risks where you can.
Right.
And certainly if you have someone that is extremely older in your home or family, if you have someone that is extremely compromised, you need to take extra precautions. But I find that this is usually the population that is already taking extra levels. They're already well aware if they have someone immunocompromised
Yep.
or compromised respiratorily, or has someone of an advanced age that might be susceptible. And most of those folks seem to be going out of their way to take additional steps, which I applaud.
Absolutely, I agree. Any plans on having to up your staffing levels or how many people are on shifts?
We're not there yet. I know we talked this morning, with police and things, that we're going to alternate things so that we're not, multiple people aren't overlapping in the same
Yep.
job, so that we don't expose too many.
Yep.
We're not there yet. We're running 7 guys a shift, 6 out the door,
Okay.
myself and the chief, in the secretary. You really can't have them staying home.
Right, right.
So we just kind of do social distancing inside.
Yeah.
A couple guys downstairs, couple upstairs, couple on the apparatus. There's not a lot of places to hide in the fire station.
right.
With only
Or the
one.
police station,
Right.
right,
So
right.
it's a work in progress.
Yep.
Sometimes it's difficult, but we're doing that aspect. But we don't have
Nothing yet.
nothing to bring in more staff on.
But what is really nice to know, and if you would speak to this, is that you do have an emergency response team in Pembroke. You've always had this.
Yes.
You plan for all kinds of things. And could you just speak to that so people really know this is not just we're popping up all of a sudden with emergency
No,
response.
no,
You've
no,
been
no.
doing
There's a little bit of
this
work that goes
forever.
into it, right.
And
Yeah.
like Ed, you had brought up when this happened before, when there was
Yeah, the first thing was Nemo.
Nemo.
Nemo
Yep.
was our
When,
first big test.
when
Yep.
that storm
was a
hit,
lot
that
of
was
fun.
the first time that we really had to put together an emergency team. We had one on paper and worked occasionally
Yep.
in the years, but Nemo was the watershed for us.
And what did we learn from our response to Nemo?
Well, number one, we found out that an elementary school wasn't the best emergency shelter,
Yep.
and that the library was.
Yep.
The Council on Aging became a warming center.
Right, right.
And we learned a lot of things there. We learned about emergency generators in public buildings.
Yep.
And so, and every year we would build upon that. Hopefully we're at a point now where I think maybe Town Hall might be the only public building that doesn't have a generator.
Yeah.
And I think we're planning on having that. So,
Okay.
so those are lessons that we've learned
They've
over the
learned.
years.
And so for something like this, have you had preps or
Many
Okay.
meetings, and some of those are as simple as conversations between myself and other department heads. Some of them, I should actually take a step back. Someone said, "What's it like to be a health agent at a time like this?" to me, and I said, "Well, I can't speak to a health agent everywhere, even though I talk to all my contemporaries." I said, "Being a health agent in Pembroke at a time like this, I am beyond words blessed." And I'm going to explain why. not every health agent enjoys a town manager that makes the time to sit and listen and engage in dialogue and help craft a plan. Not every health agent has a fire department with their entire infrastructure and their entire command system willing to sit down and work through details and struggle with pieces and parts and how do we correct some of our areas of weakness. Not every health department has a police infrastructure and command structure that's willing to say, we will make the time, we will do the drills, we will dot the I's and cross the T's. Not every health agent has a absolutely fantastic team leadership within their town hall of all department heads that are there to say, what can I do, how can I help, and how can I make it better? But most of all, people that are willing to listen, exchange in dialogue, exchange ideas, and come up with a consensus. I am truly blessed. I'm blessed beyond words to work
the
with
town
some
is
of the
blessed,
most to
too.
work with
Yeah.
some of the town.
Yeah.
The town is truly lucky, and I hope the citizens of Pembroke will realize just how lucky they are and just how dedicated some of the people are. When I tell you the kinds of texts and everything else going on over the weekend of how many people are engaged, how much of our elected leaders are so engaged and so on the front line of this, and my hat's off to them too. But when you get to work with amazing people, and the irony is, Ken and I and a few other people were just at a drill literally a month before this, maybe just a shade more, where we were going through command infrastructure, communication, how to call up from the National Strategic Stockpile, what kinds of things we had to do. And unfortunately in this situation, short of aiding our citizens directly with medical care, where there is no vaccine yet, there's not a lot we can do other than try to give good guidance, try to give good direction, and try to provide a lot of support, which we, of course, rely on the state and the federal government for that message and for that guidelines. And, of course, the governor went ahead and did on Sunday. So the first thing we said, who's available Monday morning? And we sat down. We tried to find the things in the order that were going to work great for us, and we tried to find some areas of weakness and how we were going to best shore that up. And hour later, we walked out of the room with a plan that I put on the town manager's desk an hour after that, and I believe at that point he approached the selectman for his emergency order, and I believe he's going to review the details of that plan with the selectman Tuesday night, and we're going to go ahead and we've got a template of what our guidance looks like today.
That's wonderful.
It is. It truly is.
Yeah, that's really, really terrific.
Unified Command's huge, and we are lucky that we have that group that's really unified.
Tremendously
when it
lucky.
comes to communicating. It's a learning curve, like active shooter situation that we worried about. We train for now. It's the same thing now. We're training for how to handle this as a law enforcement entity, and same with the fire department.
Right. What advice do you give to neighbors and neighborhoods? Like what, you have to keep your distance, but what do you suggest?
Look out for each other.
Yeah.
Look out for each other.
Nice,
If you
be
have
kind.
extra soup and someone else has extra toilet paper,
Yeah.
make a swap.
Yeah.
Use good hygiene, but look out for each other.
Yep.
It's going to be, I think, a long few weeks, and I think it could be longer than a few weeks, based on the numbers and the time frame we're seeing out of China. So try to be patient, be kind, and be patient. This too shall pass.
Yep. And it's a marathon. It's not a sprint, as someone
It
said
is absolutely
the
a
other day,
marathon.
which is so true. Advice.
Well, what we want our residents to know is to, go on the town website. Like I mentioned, we're going to consolidate the information that you need from each department.
Yep.
Whether it's taxes or birth certificates or whatever, and we're going to have that all on our front page, and it's going to have information that this stuff is available online
Yep.
in each department, and also a phone number, so that if you have a question, you don't have to go through the various pages of the town website. It's all going to be on the front page, and that this is a phone number. We're going to have people there, 8:30 to 4:30 every day, and so they'll be able to answer your questions,
Yep.
like Rick had alluded to earlier about the procedures that they have, and that might be added to the website as well. About hey, if you're ill, come on out, and Ken mentioned we'll escort you to the to the ambulance as opposed to going in your house.
Just
So.
do it a little different.
So we're going to try to get all that out as we're speaking.
Yep.
We're doing that right now at Town Hall.
I know that in some towns, especially with the COAs, they'll have a list of like people that have medical equipment at home or have special needs. And there's a lot of HIPAA and there's a lot of privacy issues.
Tremendous amount.
Obviously, which is critical in our society. But how can we not bend those rules, but make sure that we're there for our neighbor.
Absolutely.
How can we do that?
So you can't bend the rules. The rules are
Okay.
there for a reason. They're to protect privacy. But what our COA does, and does amazingly well, is if you're an individual that thinks you might require additional assistance,
Yep.
you may call the COA. You may give them your information. You may say to them, I have X, Y, and Z. This is all voluntary. This is why HIPAA wasn't going to come into place with this, but voluntarily, and a lot of seniors take advantage of it. And they say, I might need to be checked on in a snowstorm, or I might need this, and in a power outage, I'm out of an oxygen concentrator. And then that information is in the hands of the COA. If the fire department needs to respond to someone, they can say, hey, listen, we know this person, is probably in trouble because they don't have an oxygen concentrator because the power's out. So that information can be voluntarily given. It's usually a senior population issue, but there are a few other individuals with different issues that might also reach out. So they maintain that list, and they do a fabulous job of checking on those people. And I believe the new director just had one of her outreach coordinators kind of go through that and try to tighten up that list and
Okay.
refresh it again.
All right. Bars and restaurants.
They are closed.
Yeah, they can only do takeout.
They can do
correct?
takeout. So no
How do
consumption
you do
on site.
takeout in from a bar?
See, it's actually
Oh, a
easier than you
martini
think.
to go?
Yeah, you see, you can't.
Yeah.
So
Yeah.
obviously, yeah.
Go that
So
long, but-
yeah, for that,
Yeah.
I know, wouldn't that be
Yeah.
nice? So no, obviously,
Yep.
for bars and restaurants, obviously, there's no such thing as open alcohol to go. That's in
Right.
violation of
Right.
Massachusetts general law. But they can still, how many people tell me that Hoopsie's Bar Pizza is their favorite? So
Yep.
no, you can't sit down and have a beer while you're waiting for your pizza. But if you go there to pick up your pizza and you go, that is just fine. So
Yep.
all the establishments, almost every establishment I've spoken to, is still open. They're
Yep.
all offering to go. You may not dine in anywhere.
Right.
And there's a set of penalties that'll go along with that that's going to be put before the town manager and or town selectmen to say, yes, we agree to this. So you don't want to be caught doing that.
Yep.
Don't think that you're going to sit on the sly and have a beer. That would be a very poor decision for both you
Sure.
personally as a resident as well as the establishment.
Right.
So we ask to respect that. At the same time, if you can support local business and you're someone that can afford takeout, try to help them, limp
do
through
it.
this time. That's a great opportunity.
Yep.
Have your order all called in, and a lot of them offer pay online, which is awesome. Pay online or pay over the phone,
Yep.
so you don't even have to,
transaction,
exchange
yeah.
anything
Yep.
other than just take your bag of food.
Is there any? I just saw that one restaurant said I've applied for my permit to have the ability to do takeout. Is there?
The governor suspended that. The governor
Okay.
was very clear that they have suspended. So in food permitting, at least in Pembroke, I'm sure other communities have slight variations to this. If you're going to be, a delivery service or something else, we just have an extra box for you to check off. So technically, any Pembroke restaurant is already available to do takeout. Some have an additional step. So in our case, anyone who's licensed to serve food continues to be licensed to serve food.
Okay.
And in this case, they'll just be serving it in a box.
And there'll probably be a lot more deliveries going on the
I hope
roads.
so. I know a lot.
will.
I
Yeah,
know. No,
right?
I heard
Twice
a lot
a day
of
to the firehouse at least.
right.
Yeah.
I heard though that a lot of this was a wonderful story. I'm reluctant to mention the two restaurants that mentioned it, but as soon as I can say it publicly, I'll applaud them. Rather than have their servers be unemployed, many of them are trying to retain some of their servers and turning them into delivery drivers
yeah.
instead
Why
to give them
not?
an opportunity to earn some income as well as deliver, and of course to minimize the people going in and out of the restaurant where it can be a front porch exchange. I
Yeah.
thought that was just a fabulous idea, and my fingers are crossed that they're wildly successful with it.
That's great. That's
Yes.
great. Okay. Any last words of advice? Things we didn't cover?
Sourcing information.
Oh.
Do not go to the random aspects of the internet. Apparently, there's a fake map out there with a really bad virus to steal all your personal information and
It
data.
says it's from Johns Hopkins.
Yeah, it says it's from Johns Hopkins,
Yeah.
but now I've heard that there's 2 more possibly circulating out there. So if you really want the latest on the coronavirus, I recommend people go to the Mass Department of Public Health, which is right on the mass.gov page. They have a fantastic interactive page, which I've had up in front of me playing with. On COVID, the latest updated numbers, those are updated every afternoon.
Yep.
It is meshed usually really well with the CDC page. So if you need your data, consider going there, going to trusted sources
Yeah.
like town websites. Be very suspicious of any alluring email or as we call it, clickbait. That seems like it has some sort of flashy new thing. Make sure it's from a trusted source because I've heard of a few people whose computers and things have been corrupted by this. So be cautious of that. It's a shame that people out there, again, looking to steal
Yeah.
amid a disaster, but those folks do exist.
But most people, haven't you found that most people are great and kind and want
Yes.
to help
Yep.
and want to just
It is amazing.
that's the silver lining you always see when something like this happens is the people that step up sometimes just amaze you too,
Yeah.
that you didn't think they could or would. Now, can people still drop things off for the police and fire? I know a lot of times people like to bake cookies. And is it better not to?
Part of our special order is not to receive.
Not to, okay.
So we're
So-
not. But I believe, and Lisa would know more than this, I believe we're still taking needles, correct?
Yeah, we have certain essential services, and that's why we reviewed part of the protocol. So we review all of this. The fire department and the police department, for those that aren't filled, have a vestibule,
Yep.
which is a safe area with glass and doors and everything else. Obviously, the Pembroke Fire Department needs to continue to take sharps. People that are diabetic and others that might need to use needle-type instruments still have to get rid of their waste. Obviously, we'd ask them to wait till the last possible moment. If you can stockpile at home to minimize your interaction, please do. But obviously, there's a limit to that.
Yep.
And certainly, they can drop it off in the vestibule, and then when they're departed, someone can come out with a glove and go take it and put it in the sharps bag.
Okay.
Same thing with the police department. They do have the drug take back kiosk. Again, if people can simply wait, the 6 to 8 weeks that this will take to run its course, we appreciate that. Obviously, if you have something that just absolutely has to go, maybe you're moving or something has happened and you simply have to get something out, you can do that. We just ask you to be cautious as you do that.
And that fills up in a week.
Oh, it does?
Yeah, it's pretty busy.
Okay. Same thing with the prescription drugs?
Yeah, that's a prescription
That's-
drop off
okay.
at the police station.
Okay,
Yes.
perfect. Okay, so Ed Thorne, Town Manager, thank you. Ken McCormick, Deputy Fire,
You're more than welcome. Thank you.
thank you so much. Rich McDonald and Lisa Cullity, Health Agent.
Thank you.
And again, we'll be having these whenever necessary for all of our towns. And if you have specific questions that you want for our next forum, just go ahead and email pembrokeinfo@pactv.org. Any questions, and we'll try to get them to the appropriate people and make sure that they're answered for you. We thank you so much for joining us, and we are here to be supportive of all our towns and all our people in our towns. Stay positive, get your information from the right place, and we will see you again soon. Thank you.